Hi, I'm Vicky McDonald. I'm a consultant haematologist at the Royal London Hospital, and delighted to come and talk to you today on looking at real world data on quality of life in patients with ITP. So we know that primary ITP is a disease that doesn't cause a lot of necessarily severe illness or death. However, it has a really major impact on quality of life in patients. And we're starting to understand that a bit better. But I think it is important that we also start to understand the impact of different treatments on this. We know clinicians report that patient-specific characteristics and preference influence, for example, TRAPeze receptor agonists such as romiglastim and eltrombopog selection, but these specific factors that influence a patient preference and what's driving the patient's decision is really less well characterized. And there's two major patient surveys, some of which some of you may have been involved in one or both of these in the UK, looking at how quality of life and treatment is important for patients. There's the ITP World Impact Survey, IWISH, which is looked at participants from across 13 countries now, including the UK. And it's a cross-sectional survey of patients over the age of 18 years with a parallel survey of physicians to understand the impact on quality of life and work, and to also understand kind of how what treatments are received in the patient-physician relationship and interactions on decisions. And then there's the Thrombopoietin-Receptor Agonist Patient Experience Study, the TRAPeze study, which is much easier to say, which at the moment has been a UK-wide study and the most recent of these two studies, but is going to be expanded internationally, again, of patients over the age of 18, currently receiving or previously received a thrombopoietin-receptor agonist. And it's looking at the patient demographics, disease characteristics, and also the experiences with and preferences towards existing TRAPeze receptor agonist treatments. So looking at some of the preliminary data from IWISH before we then go on and have a look at perhaps how treatments are impacting on the symptoms of ITP. We can see from IWISH that about 20% of patients report that ITP impacted their ability to undertake daily tasks. That's quite a significant impact, with more than a third reporting that ITP had a negative impact on their normal capacity to exercise more than half the time. That 44% of patients found that ITP affected their energy levels more than 50% of the time. And the majority of patients felt it was important to have a stable and safe platelet count in ITP, but 2/3 reported feeling anxious about an unstable platelet count. And they also found that physicians do recognise the severity of ITP symptoms such as fatigue and depression on patients, but they underestimate the proportion that are affected at the beginning. So moving on then to the TRAPeze study, looking then at the influences on response to treatment and perhaps how patients perceive that. There were initially 32 respondents from the UK, most of whom completed the entire study. The majority of patients were female, which is expected in ITP, and their age ranged from 21 to 83 years with an average of 57 years. The average time since their ITP diagnosis was 9 years, and the average age at diagnosis was about 50 years old. They took part in two parts, a discrete choice experiment, which was looking really at yes/no answers to factors related to the type of treatment, and then some questions around the burden of ITP on patients to understand its impact. We found, with regards to signs and symptoms experienced by ITP patients, that fatigue was the most common symptom, followed by bruising and petechiae, so kind of changes in the skin. And then actually the next most common symptom was anxiety around platelet count, so fluctuating platelet counts and what the platelet count may be, with then some worry about the symptoms and things like unexplained bleeding. So we're again seeing this common theme of fatigue being quite a challenge, and likely relates to anxiety around platelet counts as well. And the biggest impact on quality of life was fatigue by quite some way, but anxiety wasn't far behind, and then followed by kind of bruising and other more general symptoms. So you can see fatigue is a big player here in how patients with ITP feel. So if we then went on to have a look at what the treatment patterns were, and what those influences on treatment patterns were, we can see that about 50% of patients were on eltrombopag and 50% on romiglastim, give or take. The average treatment length for patients was 2 years for eltrombopag and 2.5 years for romiglastim. So generally speaking, patients on average had been on each agent the same length of time. And 97% of patients were on or had previously had steroids, with prednisolone being the most common. And we know that steroids can significantly affect quality of life, and patients don't tolerate them particularly well. So we know that this isn't ideal, and that our preference would be to avoid having agents that make us feel unwell. Prior to the current treatment, just over 1/3 of patients had received eltrombopag and 6% had received romiglastim. So there's definitely a degree of switching going on between patients, and possibly greater number of patients having had eltrombopag first relates to it being an oral agent and it being slightly easier to consider starting this kind of agent without having to train patients to manage needles and injections and store. But that is being worked through as a potential reason as we speak. So what about treatment experiences and preferences? This is quite a busy slide, and each of the columns represents different things. So we can see the first column is satisfied with control of platelet count, then on to effective at preventing bleeding, then moving on to effective for treating ITP symptoms, looking at whether it increases energy levels, looking at about short-term side effects and then long-term side effects, moving along whether it's valued as a treatment for not suppressing the immune system and the concerns around that, particularly with COVID, treatment requiring changing to daily routine, treatment requiring changes to diet, able to adhere or stick to treatment, and would recommend it to another patient. And most patients either agreed or strongly agreed that their TRAPeze receptor agonist treatment, so eltrombopag or romiglastim, was effective in maintaining their platelet count and preventing bleeding and treating symptoms of ITP. So those first 3 columns, we can see that they're predominantly blue, which means they strongly agree to the factor talked about, and in the first 3 it's maintaining platelets, preventing bleeding and treating symptoms. In addition, about 20% agreed or strongly agreed that it increased energy levels. However, there were some where it didn't. Now, this doesn't mean that the TRAPeze receptor agonists don't work. And actually, if you compare this potentially to other therapies, particularly if you look at other studies, actually, it's likely that these do better than many other agents in controlling energy levels. But it perhaps tells us that despite some therapies, patients can still feel quite tired, and that perhaps we need to look at this in a little more detail as the ITP treating and research community, challenging people to look at more data in more detail. Patients generally weren't so worried about side effects for these agents, either short-term or long-term, but they certainly were quite pleased that their immune system wasn't suppressed, with the potential consequences for infection down the line. Most patients found it pretty easy to stick to treatment, and the vast majority would recommend this to somebody else. And when we were looking at the kind of attributes as preference, we found some of these results quite surprising. So actually, I think most patients accept that monitoring is something that patients have to have done for ITP, and some patients are actually quite pleased to be keeping an eye on the platelet count, and it allays some of their anxiety. But actually monitoring frequency of dosing, platelet count response, potential side effects weren't particularly big players in choosing a specific agent or the choice between the 2 agents, but perhaps how we give it and any potential interactions were an influence. And there were clearly some patients who very much preferred to have just once a weekly injection, but there were other patients who preferred a tablet and would take any potential dietary or other interactions. So a kind of even split, generally speaking, but patients were 5 times and 3 times more likely to select a treatment based on their mode of administration or potential for interactions with food and drugs, respectively. So just coming to the end of this talk about the kind of quality of life and pet preferences. Quality of life is affected by ITP. We can see that both from the IWISH study and from this study, and actually that's well recognised from other studies that we've done. Fatigue is a persistent symptom in ITP, and it is a problem. It is difficult to manage, and we can see from this study that actually in some patients it's what we call refractory to treatment. It doesn't respond to therapy at all. There is anxiety around platelet counts, and that is a significant factor for patients, and we have seen that both in this TRAPeze study and the IWISH study is coming out high. Some patients deal with that by increased monitoring, some patients deal with that by actually preferring not to have blood tests done, and that's quite an individual thing. But the thrombopoietin-receptor agonists are effective in managing most symptoms in ITP, and patients are satisfied with the response to therapy. I think we saw that patients were happy not to have their immune system suppressed, and I think that has come into play in the era of COVID and understanding how we manage that. Although there are a cohort of patients for whom some agents will not be suitable and the medicines that control the immune system may be our only options. But where that isn't the case, then patients tend to have a preference not to have their immune system suppressed. The thrombopoietin-receptor agonists are commonly used in ITP, and switching between agents is common practice, and this is confirming what we've seen before. We know that some patients will respond when switching between agents, and if you don't respond to one, you can try the other, and same when you're trying treatments other than the thrombopoietin-receptor agonists as well. And what appears from this study for the agents we have currently is that dietary interactions and mode of administration are important drivers of patient preference, but that actually patients don't necessarily sit in, patients can sit in one camp or the other, and some will prefer one, for example, a once weekly injection and not have to think about taking a tablet every day, whereas others would much prefer a tablet and wouldn't want to go near a needle or managing sharp spins or all the other things that go with it. So I think it's been a very interesting exercise, and as we expand this across Europe, I think it will be interesting to see whether there are country variabilities and particularly around how can we allay anxieties around counts, how can we give patients some stability with their therapies, and how do we expand access to that to make it fair and equal. So I just would like to thank the other study co-authors for this study and for the work that's been done. Names all listed there, thank you very much, and they've worked very hard. They pulled this together and was presented at the British Society of Haematology meeting recently, generating some discussions and quite a few looks and views remotely. And it's great to have teams moving forward with this. And obviously thanks to the Support Association for guiding and providing advice and taking this forward, because this was all really coordinated by Mervyn. So well done to him. Thank you very much.